I could see the big cloud of smoke that it looked like was on Main Street in Lower Lake. And I got on the highway, and as I went across, I saw flames. That was at 1 o'clock in the afternoon. By 3 o'clock, the fire was already in Lower Lake. I could not believe how fast the fire went. But it was really scary to know that the town was on fire.
20 minutes after the fire started, I got home. The flames were about 100 feet high on a ridge about a half mile from my house, and it was rapidly progressing. Had a strange feeling that I shouldn't leave. The fire chief's report to me was that the fire was moving faster than the valley fire that took so many homes last year, and it was moving directly towards the hospital. He said, "You've got to evacuate the hospital."
When the fire started ramping up on Sunday, I was here, so I just took over as incident commander. From the time they told us to evacuate until we had evacuated completely, it was a little bit over an hour. I do recall a phone call from our fire chief saying, "You have 15 minutes." And we had 4 patients left in the building at the time. And they were our most critical patients because that's the way you evacuate. That patient was very critical in our ER, and we had started that before we went into this evacuation mode. And luckily, the helicopter was able to make it in even through the smoke and picked up that patient, and that was our last patient out of the building.
They lose everything, It's not like you have time to pick and choose what you'd like to keep or save. It's just gone. Rick Sanchez, who was our emergency coordinator, he lost his home, which was devastating.
Didn't find out for, I think, 3 days. It's always been my priority to make sure that the people are okay, because all I lost was things. I didn't lose people, I didn't lose pets. And I would much rather take care of my coworkers and the patients here than worry about my house.
And he was here making sure the hospital was running, making sure we were providing good patient care up until the time, of course, when we were evacuated, and then he was a big part of that. And the whole time throughout it all, I didn't hear him one time say, "Hey, that's my neighborhood, I need to go." He just had a job to do, and he did it.
As soon as the last patient was out, we started talking about how do we get reopened? How do we get the patients back in here?
I didn't want our hospital to be closed for 30 days. One of the key factors was that they locked the door and nobody was in the building. By me staying inside the building, when the Department of Public Health comes in and they ask about systems in the hospital and how we know that they were running, I could say because I was here.
We cleaned the hospital from top to bottom 4 times total to make sure that when the state came in to reopen us, there would not be an issue with anything being dirty.
I helped out the fire department, delivered water to people, checked on houses with them. And as I was going through the ashes of my house, they were helping me. But it's an amazing community here. We've been through a lot, and everybody really pitched in to help.
It's everybody working together the best they can and as fast as they can to protect our patients and our community.
For a whole month, we were providing breakfast, lunch, and dinner, feed those people that didn't have a home. We always had people come up and help, not only serve the food, but the stores around here were helping, donating so that we could continue. The whole town came together like a family. I couldn't help them with money, but I could, I'm a cook, so I could help them with fixing meals.
Just to see the outpouring of people that are like, "Hey, I might have lost my house, but I'm still here. How can I help?" It's everybody. People that have nothing are out, giving what they have, their time, their strength to help. It's one thing to give out of abundance, but it's another thing to give when you don't have much to give. And that's pretty evident here.